In this video, I'm going to go over radial tunnel syndrome. What is it? How does it happen? And what can you do to treat it at home? Radial tunnel syndrome is irritation or compression of the radial nerve on the outside of the forearm right here. It can commonly be mistaken for tennis elbow, and it's more common also in females ages 30 to 50, more common in diabetics, people that perform repetitive strain, kind of work where you're maybe doing the same thing with your wrist or your forearm all day. That can cause you to be more susceptible to develop radial tunnel syndrome. It's also can occur from when you have a direct blow, maybe you're playing football or you fall and you have an impact on the outside of the elbow or the forearm there. That can cause irritation to the nerve. Sometimes I've even had patients that originally had tennis elbow and they wear one of those tennis elbow straps and they put that on there and that compresses the radial nerve. They get it too tight and that compresses the radial nerve. And they may notice, or you may notice, pain or numbness that travels down the back of the forearm here that goes into the back side of the hand, the index side and on the thumb side here. Those are common complaints patients report, either pain or numbness. And that's really the biggest difference that I see between a tennis elbow diagnosis versus the radial tunnel is going to be that lack of sensation, that numbness or tingling. You can also have burning, and some of those symptoms, again, related to pain and burning and tingling, can mimic tennis elbow. So that's one of those things you just kind of got to go through the different tests for both to see kind of which one's going on. There's no definitive test to completely rule in or rule out radial tunnel syndrome. You're going more on symptoms and location of symptoms, and from there, then you just formulate your treatment plan accordingly. For our treatment, we're going to work on a few stretches and nerve mobilization techniques. So the first stretch that we're going to do is you're going to bring your elbow out straight. You're going to bring your wrist into flexion, so you're going to pull that down. You're going to feel that stretch back here on the nerve. If that's too intense, you can back off, but we're going to work on coming all the way down. I have my fingers down straight. If you want to make this more of an intensive stretch, you can curl your fingers down and make a fist and then pull back. You're going to hold that between 10 to 30 seconds, repeating that several times a day. But again, if that causes too much burning or irritation, just back off or keep your fingers straight during that movement and don't curl them down. Our next mobilization technique, you're going to start with your hand in an extended position at the wrist. Palm is open, elbow bent, and then you're going to kind of straighten out your elbow, and when you straighten out your elbow, you're going to make a fist. So my elbow is straight, have a fist made here. All my fingers are flexed down, and then I'm going to bend the elbow back up, and then I'm going to straighten my fingers back out. So you go this position, elbow straight, and come into a fist. You repeat that for 1 to 2 sets of 10 to 20 repetitions. Our next mobilization, you're going to start with the elbow bent. Palm is facing upwards, fingers back in this position. And now what you're going to do is you're going to work on extending the elbow all the way out and then curling the fingers down. And then we're going to bring the elbow back and then straighten out the fingers. So elbow out, fingers down, elbow back, fingers extended. Our last mobilization technique, you're going to start with the elbow flex. Palm is open, wrist is in the extended position. So we're going to start like this, and then you're going to straighten out the elbow. You're going to flex the wrist, close the fingers, and you're going to tilt your head so that your right ear comes to your right shoulder. And then what you're going to do is you're going to bring the elbow back up, wrist and fingers open, and then tilt your head to the opposite side. So we're going to go through that one again. So elbow bent, palm is open, wrist is in the extended position, so my wrist is back. And now what we're going to do is straighten out the elbow, flex the wrist, bring the fingers down and make a fist. And then we're going to tilt my head, my right ear over to my right shoulder. Then we're going to bring the elbow back up, wrist up, fingers back, wrist back, and then I'm going to tilt my head away. There are a lot of different variations that you can kind of play with these nerve mobilizations or flossing techniques, and I don't believe that any one in particular is just absolutely correct. You really have to find the one that seems to work the best for you. Those are just some of the ones that I really like to use when having radial tunnel syndrome. Thank you so much for watching. I hope this video helps resolve your radial tunnel syndrome. Make sure you hit that subscribe button so you can keep up to date on all my current content. Thanks again.